Hey, it's Jordan. Delighted to be joined by Stephen Lester. He is a Harvard-educated chemist and the science director at the Center for Health Environment, Center for Health and Environment. And you have been to East Palestine, Ohio, since this disaster happened, and have been among several experts calling for more some transparency, if any, from the EPA. And I think there's a major, in my view, scandal going on that unfortunately is not getting much attention from the mainstream media. I broke last week that the EPA, despite telling residents of East Palestine and Western Pennsylvania that it was not detecting vinyl chloride, which is a very, very toxic gas, they detonated 116,000 gallons of it. That would be Norfolk Southern over this area 16 months ago. The EPA has been saying they're not detecting it, but an official told a resident recently that it did detect it, tried to play it off that it was a low level, that they dug it out, and no issues. So I followed up with the EPA to ask specific questions, like, can you give me the date that it was detected? Can you tell us what the concentrations were? How deep in the soil this was, if groundwater was compromised? The agency got back answering none of that, and just gave me kind of a vague, lawyerly statement. And 3 days after I broke that story, they quietly released on their website on Friday. I'll show you. Kind of again, seems fairly innocuous, minimized statement about what they found. They said that they found 3 small areas, as they called it. Let me highlight it here. 3 small areas on site where significant hazard and substance management operations occurred, showed low levels of vinyl chloride present just above site screening levels. In accordance with the approved plan, soils removed for off-site disposal. You're the expert. Again, I asked them. They still have not responded. I asked them again today, what were the levels? When was this detected? Not providing any answers. I don't really understand, A, what does it mean, low levels of vinyl chloride? And number 2, what are these, quote, what constitutes a small area? And why was this not told to the public much, much earlier?
Well, my reaction to all of this is that this is consistent with the way EPA has behaved since the day one in East Palestine. They have been reluctant to share information. They have been reluctant to do proper testing. They have been reluctant in any way to share with the public what they're finding. At this stage, 16 months later, I have to ask the question, what are they afraid of? Why won't they share information? I mean, they burned vinyl chloride. It created dioxin, created a host of other problems. So the people have been exposed to toxic chemicals in this community. And they've been told all kinds of narratives and stories from EPA, and they've given the community very little real and honest information. And this is just another example of that. To find vinyl chloride 16 months later in the soil could be significant in terms of what people have been continued to be exposed to during this time. Again, as you said, without the details of how deep was it, how much was it, did they actually find now? Is this an area where groundwater would be impacted? I mean, there's lots of questions that people would want to know. The fact that EPA won't share any of this information raises the specter of what are they hiding? What are they afraid of? Why won't they release this information? Having been through a number of these community situations before, my gut feeling is that they're afraid that if people know what really happened and what they actually found, they won't be happy. They'll believe they've been exposed to chemicals, which is something they already not believe anyway, but they'll have sort of evidence that it's been occurring. And so I think that this is part of the problem here, is that EPA is afraid to release information because it's inconsistent with their narrative, which is everything is fine. And so, but I think finding vinyl chloride 16 months later is really important here, because vinyl chloride is not a stable compound. It's not something that will stay in the same form that it is for months and months and months. For example, the ATSDR, Agency for Toxic Substances and Disease Registry, has a toxicity profile on many chemicals, hundreds of chemicals, including vinyl chloride. I looked up in there what the status is on vinyl chloride in soil, and it said that in 1 month, you expect 99%. Actually, it's not 1 month, excuse me, 15 weeks. In 15 weeks, 99% of the vinyl chloride in soil will have either passed into the air or passed into groundwater and passed through it. So, I mean, the question then begs the question, well, my goodness, if whatever they found there is now 15, 16 months later, what was it originally? And I think that's the question. And what's happened to that vinyl chloride in those 16 months? Has it evaporated? I mean, these chemicals can evaporate just through the soil into the air from a position of, let's say it was 1 foot or 3 feet into the soil or underground. I mean, you don't expect it to be very deep because it's not like it was dug there. It all came from the surface and percolated down. Right. So, I mean, maybe they may have removed some initial topsoil. I don't know, but it wouldn't be very deep. So it's either moving into the air and people have continued to breathe it, or it's the groundwater and the surface water as rain has come through and percolated it down and carried it away. And so whatever is there is what's there now is a result of all of these movements and activities in the last 16 months.
And also, for the layman, it's not like vinyl chloride just chills there as weather changes. Is it correct that vinyl chloride, I mean, can go down into the groundwater or up into the soil based on the weather?
Yes, weather conditions and just its natural tendency to move. It's going to evaporate, it's going to volatilize into the air, and it's got certain solubility in water, so it's going to move with the groundwater and the surface water as it percolates through it.
And I also asked them because my understanding, and I'm not a chemist by any means, is when it's broken down into the air, it develops into formaldehyde, hydrochloric, hydrochloric acid, carbon dioxide.
And trichloroethylene, another volatile organic compound, it will break down in the soil.
So you would hope that the EPA is testing for these things if they're digging vinyl chloride out, because the EPA told this resident via text message that we didn't detect it in the air, vinyl chloride, after we dug it out. Well, I don't know what they're testing with because there's been a lot of criticisms of their testing methods. I don't know when they tested. I also don't know if they tested for these other things. And I'd also like to ask you, because, I mean, the EPA, it's not just with this, but I mean, they have a lot of arbitrary numbers, in my opinion. You know, they say 15 parts per billion is acceptable for lead, but anything above 15 parts per billion is considered hazardous. Well, health experts would tell you that's arbitrary and 0 is acceptable for lead. So I don't really know how they come to their conclusion of what is a low, non-threatening level of vinyl chloride. And this is not in a vacuum. So if they're finding, quote, what they think is low level vinyl chloride, well, that's, quote, low level vinyl chloride on top of many other chemicals that the residents have been exposed to.
Yeah, that's exactly right. Very few of these guideline values that EPA often refers to are not health-based. They're not based on evidence or science or research on people and how they respond to exposure to these chemicals. And for obvious reasons, we can't expose people to these chemicals and see what happens to them. So it's risk numbers that are generated by a whole lot of assumptions about what we know and don't know about these chemicals. So they're not magic numbers, they're not health-based. And so I have a different perspective, because if I were going to do these risk assessments, I would have a very different outcome than what EPA does, because I would want to protect people and I would care about that, and I would calculate these things in a different way. So it's not a consensus number of safety. which is what EPA is implying when they talk about these numbers. It's a judgment on their part. It's their opinion that these numbers are quote unquote low. If it's so low, share the numbers. Let others decide and look and see and evaluate whether they believe that in fact is the case for others. And again, EPA won't share that because I think they're afraid. I think, and you can't help but think, given the history here as well, that EPA doesn't want to share this information because they are afraid that people will be angry and upset and fearful of what they have found. And so, and why would they not think that when they won't share it with them? So in other words, it just creates more anxiety, more frustration, more anger in the community about what's being, the way EPA is handling this. And it's been awful the way this has been occurring since day one with EPA, and it's really frustrating for everybody involved.
And also from a chemistry perspective, we assume, based on what the EPA told the residents, that this is by the derailment site. But it really doesn't make sense to me why it would, if they're finding it, why it would be isolated only to the derailment site. I mean, that plume went far and wide. I don't know if they're testing, where they're testing, if they're still testing in a broad spectrum of areas. But does it make sense to you that they'd only find, if they're finding vinyl chloride in soil, that it would only be in this quote small area by the derailment site, or could there be vinyl chloride further?
Yeah, I mean, it's awfully hard to say. I mean, I would imagine that there's more vinyl chloride out there. We don't know, as you said, where this is located, whether they've already excavated areas and maybe tested for this or not. We don't know, a whole lot about what they're finding. But it's reasonable to think that if they found it in these couple of spots, that it's in other places. What I imagine most of this vinyl chloride is a result of them dumping the container, the tanker cars into the ditch along the side of the train and burning it and setting it on fire. And so that's the area where you would expect to find this. And that's quite a huge area from what I understand. It's not just a small area. Maybe this particular finding was that. But I would want to know more about how EPA is testing and what they're using to monitor what's in the air. I mean, in the past, some of the monitors they've used have been generic monitors that aren't unique to even vinyl chloride, just to volatile organic compounds. And they're not very sensitive. So you might have parts per million parts per billion, which are of concern for exposing people, and there are high risks with parts per billion, let alone if their detector is in the parts per million, it's going to say, well, it's not there, but it could be at lower concentrations that are significant from a health point of view. That's not being detected. And so what are they using to detect this? Again, it's a matter of transparency. Why won't EPA share what they're doing? And I have to think it's because they're afraid. They're just afraid to disclose the truth and be honest with people, because people will expect them to do things because of what they're finding at the concentrations they're finding. They're expecting more actions than removing it and telling everybody everything was okay.
Well, this is speculation, but just timeline wise, I don't know when they detected this. It could be recent, it could be months ago, and they didn't tell anyone. At the same time, they were negotiating a settlement, the EPA, with Norfolk Southern that recently came out for $310 million, which, in my view, is a pittance of what the residents should be getting. So, if you're negotiating a settlement, it probably would not be good to announce that you're finding, the most concerning gas that was released. I don't know if that would help residents or anyone swallow a settlement for $310 million if that is still being found.
Yeah. Well, the other thing about vinyl chloride is it's a highly toxic chemical. It causes rare cancers. It causes central nervous system problems, reproductive outcomes, and immune system problems. It's a nasty chemical. So at extremely low levels. So when they say they're low, what are they? Share that with us, because people have continued to report health problems and symptoms and frustrations, and so perhaps this is, and if they found it there and it's been getting into the air there, maybe it's still coming into the air from other places. I mean, that area where they did the burning, I know they've done a lot of work there and a lot of excavation there, but a lot of that excavation and work is releasing this stuff into the air again and still. And so that may be contributing to the problems people are reporting. I don't know, but I can't assume that it's being done in a way that isn't releasing it, because from everything I've seen, they are releasing every time they excavate and remove soil. And what little I've seen, because I've only been to the site a few times, but what little I've seen in terms of their protections for workers and people dealing with these cleanups has not been very good.
Right. And yet, I have a bigger 360-degree question, and this goes from Flint all the way to East Palestine. What is the point of the EPA if they are not going to take control of the situation? In Flint, EPA knew for well over a year of the water complaints. They learned, I believe, a year after the water switch, but well before it became public, that the state was not adding the proper chemicals. Yet they did not take it over and interject themselves and basically take over the response. In this case, they let Norfolk Southern handle the emergency response in the first place, and the EPA says, and this official told the resident, if we find areas of concern, we tell Norfolk Southern to deal with it. Well, I understand states' rights versus federal, but at the end of the day, what is the point of having a federal environmental agency if they are going to take a backseat to corporations, or what many people believe is work with the corporation to cover it up?
Well, I think the EPA has really fallen on different times in recent years, and Flint and East Palestine are both good examples of the way the EPA works hand in hand with companies to address problems. And so they don't represent the communities. They don't bring the best concern about the communities to these situations. And I think the agency, when it developed a mission, when it came into existence, really cared about the environment, really cared about public health, really cared about people. And I think that situation is no longer the case. I mean, I find the EPA is more concerned about protecting corporations and developing and protecting a narrative than they are providing information and answers to the communities. I mean, their mission is to protect public health. It's on their website. It says it in black and white. But the way they've operated in East Palestine has been nothing consistent with that. And I think they've failed the public. They've failed them in Flint. They're failing the public here. They're failing to protect the public's health, and they're failing to do the kinds of things that people believe that government's supposed to do for them. People believe that government's going to take care of them. They're going to do the right thing, that they're not going to lie to them. They're not going to give them false information and false hope. Instead, we get the opposite of that in these situations, and EPA is not, in my opinion, is no longer serving the best interests of communities and the public.
And my last question, I mean, this is the second summer now that the residents there, and when I say there, this is not just East Palestine. There's a lot of affected people in Western Pennsylvania, particularly Darlington area, because that plume went well over state lines. Obviously, when the weather gets hotter, chemical concentration, it affects people have health effects. I was just there. I felt like crap very quickly, including a headache, feeling deliriousness. Residents are talking, I've interviewed a resident, 18-year-old who's having seizures, was healthy before this. Reports of strokes, still bloody noses, cognitive issues, menstrual cycle changes in women. I mean, there's a long list of issues. If we don't get the correct data or full transparency, should the residents, should they feel like, it's just a matter of time before their health issues potentially get worse, including cancers?
Well, it's awful hard to say what's going to happen down the road, but I think that it's clear that the EPA and any efforts to try to monitor the future of these health problems is not going to provide the answers anybody is looking for. I mean, one thing that might be of help in this situation, let me propose an idea. I was involved at Love Canal in Niagara Falls, New York, a long time ago. And one of the things that the community settled for was the establishment of a trust fund for future healthcare costs. And $1 million was set aside back then in 1985. That's when that settlement was made. $1 million, not a lot of money. And they had 1,300 individuals involved in this lawsuit. So it's a significant chunk of people, not as many as are present in East Palestine, but still a significant chunk. So to this day, anybody who was a party to that settlement is essentially free health care. And that is something that might be helpful to the community if they were to include something like that in a settlement here, that they would provide health care for everybody. So out of whether you have it or not, it's a third party, last dollar kind of option for people to get health care. And they don't have to prove that their health problems were caused by the plume. They don't have to prove it was caused by anything. They just have to be a party to the settlement. And that, I think, would be something that I think would be really helpful to the community, because at least you won't be paying for health care. You know, that'd be one thing. And you know, that would include diagnostic tests and tests that try to get ahead of health problems before they occur, which a lot of healthcare now won't cover for diagnostic tests. So that's something that might be included. So I just throw that out there as maybe something that might be helpful for the community and others to consider. You know, when you think about all these questions that nobody's going to have about their health problems, all these questions, and people will get sick. They're sick now. And you know, when you go there, you know, people experience what you expressed. You know, you go there, you feel different things. You feel not right. You feel central nervous system issues, and that's probably because the chemicals are still in the air. Some mixture of them is still around. Absolutely. Not at the air, maybe, and certainly not at the concentrations they were after the accident, but it's still there. And we as scientists can't answer the questions about what's going to happen to people. We just don't know, because we don't have all that information. And what little we have, we don't get from EPA because they won't share it. So we don't even know, you know, no independent people can't assess and judge and help people understand what's going on here in terms of their health. And so with the best of science, we don't know what's going to happen to people. So in that climate, one step forward is to help people with at least their health care. And that could be done through a settlement. It hasn't cost the company at Love Canal $1 million. That $1 million is still there. And, you know, we've been paying out anywhere from $150,000, you know, $100,000 to $150,000 in benefits to this group of people. So it's I think a very useful, practical thing that could give back to the community, at least one little thing.
Thank you for taking the time. Stephen Lester, Science Director at the Center for Health, Environment, and Justice. Thanks.
Appreciate it. Thanks for having me. Take care now.